Superior, middle, inferior nasal concha. Between them, these depressions are the meatuses. At the end of this is the internal nair. External nair, internal nair, opening to the eustachian tube. Pharyngeal tonsil, palatal tonsil, lingual tonsil. Now the regions of the pharynx. This is the nasopharynx, so you find the nose come all the way back. So if I ask you to name this region, it would be nasopharynx. Oropharynx, find the mouth all the way back, oropharynx. Larynx, this is the laryngopharynx. This is the epiglottis, which I would ask on this model. You could also see the false vocal cord, the true vocal cord, that white band, and the opening as I put the stick between it is the remiglottis. So everything from here up, I would ask for the upper, and then for this model, this is the larynx. So you have the hyoid bone, thyroid cartilage, cricoid cartilage, tracheal cartilage, thyrohyoid median ligament, thyrohyoid membrane. Look at the angle of the fibers. Here you have the membrane. Here you have cricothyroid membrane, cricotracheal ligament. Each of these are tracheal ligaments. Each of these are tracheal cartilages. This is the thyroid gland. The epiglottis. Let me get a model with it on it. So, okay, if I ask the epiglottis, I'm going to have a model like this that actually has one. All right? So, epi above the glottis. The glottis is the opening. Epiglottis, hyoid bone, thyroid cartilage, cricoid cartilage, tracheal cartilage, thyrohyoid median ligament, thyrohyoid membrane, cricothyroid ligament, cricotracheal ligament, tracheal ligaments. And that's what I would do with that. For this model, I would start with the trachea. Here's the trachea, and it's going to split to become the left primary bronchus, secondary bronchus, tertiary bronchus. They enter into the lung proper at the hilum. One over here and one over here. In red, these are the pulmonary veins. In blue, these are the pulmonary arteries, all entering at the hilum. This is the mediastinal surface, this flesh tone area. This is the mediastinal surface, but notice there's a depression in the left side. That's the cardiac notch. All right, so if I put a sticker here and I ask you to name the depression, it's cardiac notch. If I ask you to name the surface, it's mediastinal surface. The flat bottom part of the lung is the base. The pointed tops are the apex, and this is the diaphragm, the principal muscle of respiration. Finally, this is the costal or visceral layer on the surface of the lung. Yeah.
That's all she wrote?